Dear all, best wishes on the occasion of World Pulmonary Hypertension Day. Myself, Dr. Shine Kumar, Professor and Pulmonary Hypertension Specialist in the Department of Paediatric Cardiology at Amrita Institute of Medical Sciences, Kochi, Kerala. I will be talking briefly regarding the challenges of managing pulmonary hypertension patients in India. The foremost challenge is at the stage of diagnosis. As you know, pulmonary hypertension is a chronic illness which cannot be identified by a single test or a simple physical examination like other illnesses, for example diabetes or hypertension. So usually the patient presents in advanced stage of the disease in a compromised manner, and hence the early opportunity to treat the patient is lost. So this is one important challenge which I face, where the public awareness regarding the illness is less, and the medical fraternity, though aware, is burdened by their clinical load with other significant illnesses, and the disease has not yet come in the radar of the government health agencies. Once diagnosed, again creating a perfect workup to pinpoint the diagnosis is very important. And in India currently, there are very few centers which have dedicated pulmonary hypertension services combining all the specialties, including the facility for cardiac catheterization and appropriate testing. Very few centers do this, and many centers do not do this because there are lack of facilities or expertise, and hence most often the patients may get diverted to an inappropriate level of management. Finally, while treating the patient, the affordability of the pulmonary vasodilators which are currently available in India are high. For an average Indian patient, most of the time, the initial starting therapy itself can cause a significant burden, economic burden for the patient. Moreover, we do not have the advanced therapies like prostacyclins, either intravenous or inhalational in any way, and importing these medications are prohibitively expensive. So it's high time that we support this specific subset of patients in all the way, economically by subsidizing the medications, which is set a good example by the Pradhan Mantri Jan Aushadhi program, where the sildenafil and the tadalafil tablets are already available at a lesser rate. The government should bring the other medications also under this umbrella so that it becomes more economically viable for the patients who needs long-term medication. And a much more awareness regarding this illness among the public and the medical fraternity should be initiated, and the previous impression that pulmonary hypertension is a fatal disease and there are no treatment options for the disease are vastly changing with the current progress in the science. Moreover, we need to lend them adequate social and economic support which are thoroughly lacking in the current Indian scenario. I sincerely wish that good organizations like the Pulmonary Hypertension India can come up with patient education and support groups which can improve definitely the quality of these patients. Thank you.